Well, good morning. Today on our Wellness Wednesday, we're going to talk about anxiety and panic attacks. And joining us to know all about it and really help walk us through this is psychiatrist, Dr. Kristina Kennedy with Baptist Health Behavioral Health Clinic. So welcome.
Good morning.
Good morning to you. So let's talk about it. Anxiety, panic attacks. What do you want people to know?
So I want people to know that anxiety is a normal response. So of course, if you have a big event coming up in your life, if you have a big exam or a new job or planning on moving soon, you're going to feel anxious. But if you're worrying about things all the time and it's impacting your life, or if you're having panic attacks, for example, then that's probably the time that you should seek help.
So that's when that could clue you in to believing, you know, maybe I do have anxiety about other things, not just these big events. Like I'm constantly worried, I'm constantly nervous about things. And let's talk about panic attacks. Is like, what exactly happens? Because I know a lot of people, some people still think it's a little woo-woo, but they are very real and they can be absolutely debilitating to some people. So go ahead and explain, what is a panic attack?
Yeah, so a panic attack is essentially when you get an intense, severe feeling of anxiety that comes over you. And it can happen at any time, really, often in stressful events. But there are a lot of physical symptoms, and so people can have chest pain or trouble breathing, and pretty frequently people will say it feels like they're having a heart attack. And so you can imagine it can be really scary for people. And so that's kind of the difference, and so it's just more of an intense version of that.
Yeah, like trouble breathing, shortness of breath even. It can be very scary. And I'm also seeing here that some symptoms of anxiety are trouble sleeping, trouble concentrating, and even feeling weak or tired. Can you explain that?
Yeah, so if you're up, if you're thinking about things all the time, you can't stop worrying, it can keep people up at night, and it can have an effect on your body if you're just constantly on edge. And so with all of those symptoms, of course, it can just feel draining to a lot of people.
Can absolutely just wear you out. So what are some things that we can do if we think that we are experiencing a panic attack? What can we do in that moment to kind of bring us back down a little bit?
So certainly just doing some coping exercises like breathing and things like that. But if you're having panic attacks or even just anxiety that has a lot of physical symptoms, I really think it's important to talk to your doctor and make sure there's nothing medical going on. So like I said, it can feel like you're having a heart attack. So obviously you want to make sure you're not having that. And then some of the other symptoms that you can just have with anxiety, or like feeling like you're really tense all the time, or like your heart's beating really fast and sweaty. And so sometimes it can be something with your thyroid or some other medical problem. So the first thing to do is make sure to talk to your doctor and rule that out. And then if that's not going on and it is an anxiety disorder or a panic disorder, then there's different medications or therapy options that can be given.
You don't have to suffer, right?
Exactly.
It doesn't have to be this way. Dr. Kennedy, thank you so much for joining us again this morning. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.